this episode, we'll talk about what causes rotator cuff tendinopathies and how to treat them. First, let's start off with the anatomy of the shoulder. So for bones, we have the scapula, which is the shoulder blade, and then we have the humerus, which is your arm bone. And so there's a little part of the scapula that comes off, which is called the glenoid, which is actually where the head of the humerus sits. And so it's not actually like this. The glenoid is actually a lot smaller, so structurally the shoulder isn't all that stable. And that's where the rotator cuff comes in. So the rotator cuff is made out of 4 different muscles. We have the supraspinatus muscle, which is on the back, which helps with lateral flexion. We have the infraspinatus and teres minor, which sit on the back side of the scapula, which do external rotation of the shoulder. And then we have the subscapularis muscle, which is actually on the front side of the scapula, and that helps with internal rotation of the shoulder. All 4 of these rotator cuff muscles blend in to form the joint capsule around the glenohumeral joint, and so they're really the ones responsible for the stability of the shoulder. The most commonly affected tendon in the shoulder is the supraspinatus muscle, which was the one on top of the shoulder blade, but any of the tendons can be affected. Whenever somebody has shoulder pain caused by an irritated tendon, whenever they use the shoulder, it'll be painful. Generally, it's worse with loading, so if they're lifting something, especially up overhead, that will generally cause more pain. Rotator cuff pain can also affect sleep, and that's because generally when we sleep, if we're sleeping on the shoulder, it'll cause compression of the tendon against the bone, which will lead to some more pain. Tendinopathy is the current terminology used to describe tendon pain. Formerly, we used to say it was either tendinitis or tendinosis. Both of those terms have been abandoned in favor of tendinopathy instead. For the pathology of tendinopathy, there's generally 2 stages. We can have a reactive tendinopathy or a degenerative tendinopathy. The reactive tendinopathy occurs with a sudden increase in loading. So this would generally be someone who just started going to the gym and they started either doing bench press or a lot of overhead press, and now their shoulder starts to hurt. What occurs in a reactive tendinopathy is that the sudden increase in load triggers the tendon to grow more tendon cells, and that brings fluid into the tendon, separating the fibers, which leads to a little bit of pain. This separation of the tendon cells is generally reversible, so with rest, the fluid accumulation in the tendon will actually decrease, and so it'll revert back to the normal tendon. We can also have a degenerative tendinopathy, and this generally occurs with prolonged overload of the tendon. So this is someone who has been doing either a lot of bench press or a lot of shoulder work for a long period of time, and they're just consistently overloading the tendon. In this stage, we'll have more tendon destruction, so that increased separation of the cells creates a weaker tendon, and then we can also have some destruction of the tendon cells, so we can have some minor tears in that rotator cuff muscle as well. The changes in a degenerative tendinopathy are generally not reversible, so any cell destruction that we have will be permanent. However, we can always build more tendon cells around the tendon, so that way we can have a nice healthy tendon. So because we have 2 different stages of tendinopathy, that means we'll approach treatment of both of those stages a little bit differently. For a reactive tendinopathy, load management is key. So essentially what this means is that if we're overloading the tendon, we have to remove some of the load that we're placing on the tendon. There's 3 different ways that we can achieve this. We can either reduce the frequency that we're loading it, the duration that we're loading it, or the intensity that we're loading it. For example, if we have someone who's going to the gym, we might limit how frequently they're going to the gym. So if they were going 5 days a week, we might only have them doing 3. If they're bench pressing 250 pounds, we might have to reduce them to 135 instead. Or if we're looking at duration, we might cut some of the exercises out. So if they're always doing military press and bench press, we might limit them to only military press or some sort of different shoulder exercise. It's important to note that we don't want to completely offload the tendon in a reactive tendinopathy. We want to try to keep people as active as we can without causing further irritation of the tendon. We want to create a period of relative rest versus absolute rest. And this is because if we create a period of absolute rest, we're completely offloading the tendon, which will cause something called stress shielding, which is where the tendon will actually become weaker because there's no load on the tendon. And like I was mentioning before, this kind of sets somebody up for the potential of further injury in the future because once the pain has subsided, then they're going back to exercise with a weaker tendon, which is not what we want in a rehab process. In a degenerative tendinopathy, our goal is to increase the tissue tolerance through progressive loading. This will stimulate the tendon to build more tendon cells, and thus will make a stronger tendon. Generally, when we're looking at these programs, we'll start with isometric exercises. So we will contract the muscle without actually moving the joint. So for supraspinatus, we might do a lateral raise, but we'll just have them hold weight here. And so my shoulder actually won't move, but I'll hold the weight there for about 30 to 45 seconds. These isometric exercises have actually been shown to help reduce some of the pain, but we have to load them fairly heavily to stimulate that analgesic effect. So generally we want to have it about 40 to 50% of max, which seems like a lot, but because we're actually not moving the joint that much, it's actually not that much load on the shoulder. And then we could progress to concentric and eccentric exercises, so gradually just increasing the load on the tendon, which will help stimulate it to grow more tendon cells. For someone who has a degenerative tendinopathy, they've generally had pain for a fairly long period of time, which will make them look for some sort of pain management strategies such as corticosteroid injection. In this stage, it's generally not a good idea to have a corticosteroid injection because generally in a degenerative tendinopathy, there's not that much inflammation actually in the tendon. Along with the absence of inflammation in the tendon, corticosteroid injections will also weaken the tendon, and so that's kind of counterintuitive to what we're trying to do with the degenerative tendinopathy. Instead, manual therapy can be used as a pain management strategy, either in the reactive or the degenerative tendinopathy. So we can use like a pin and stretch or some sort of instrument-assisted soft tissue modalities such as Graston. And those therapies will help stimulate the skin, helping to reduce some of the pain, and therefore helping the loading process be a little bit more tolerable. Even though with a tendinopathy, we're generally just focused on the tendon itself, that doesn't mean that other muscles around the shoulder aren't influential as well. So we'll generally want to take a look at the mechanics of the shoulder blade, make sure that it's moving properly and is very supportive of the shoulder. So looking at upper traps, serratus anterior, and the lower traps to make sure all of those are functioning properly. We can also look at the thoracic spine, which is the mid-back, to make sure that we have adequate mobility and stability there, and that they're not causing any trouble for the shoulder as well. Thank you guys so much for watching another episode of Monday Mornings with Michael. Hopefully you guys found this information helpful if you're dealing with some rotator cuff problems. If you did, please like this video and don't forget to subscribe to our channel.